Hi, I'm Dr. Skender Bene. I am the Medical Director for Sleep here at Bluepoint Medical Associates. I'm here today to talk about sleep apnea. Sleep apnea is cessation of breathing while we are sleeping. In the United States, it is estimated there are about 22 million people with sleep apnea. Only 20% are diagnosed. So if you look at it, there are 80% of people in our society that are not diagnosed yet. Now, the way to know if we may have sleep apnea is there is some association with family history. If anybody is diagnosed with sleep apnea in your immediate family, that could be an indication. The symptoms are patient snores, they stop breathing. The spouse or a family member may notice that the patient stopped breathing, and they may thrash while sleeping. They may gasp for breath. The patient would wake up and the sleep is not refreshed. They feel tired in the morning. During the day, they fall asleep while engaged in passive activities, reading, watching TV, sometimes even driving. Other symptoms include morning headaches and dry mouth in the morning. In addition to those, if you have high blood pressure or if you have diabetes, those are also indication for screening for sleep apnea. The treatment options, one may differ by the severity of sleep apnea, but surgery is an option. This is where an ear, nose, and throat surgeon would do a surgical procedure to widen your airway. The second option is dental appliance. A dentist can construct a dental appliance that will keep your airway open that you use at night. These are mainly for mild or moderate sleep apnea. The third option is CPAP therapy. This is the machine and a mask that blows air into your airway to keep it open. It works as a splint, and this can work for mild, moderate, severe sleep apnea. And the fourth one is something that FDA approved recently. It's just coming out in the market, is a pacemaker that would treat sleep apnea, especially moderate and severe sleep apnea. Sleep apnea is now termed as a silent killer because people don't realize that the complications that can come from sleep apnea. Now, sleep apnea can lead to high blood pressure. 1 out of 4 patients with high blood pressure have sleep apnea. It can lead to type 2 diabetes. 3 out of 4 type 2 diabetics have sleep apnea. The risk for stroke is high in sleep apnea patients who are untreated. Risk for heart attack is high. It can lead to to atrial fibrillation, one of the irregular heartbeats, and also it can lead to heart failure. So if you look at the consequence of not treating sleep apnea, is huge. If you look at sleep apnea, the biggest risk factors are, one is genetic structure, having genetically narrow airway, but one of the other biggest risk factor is weight. So the more weight we gain, the more weight we accumulate in our neck area, the more tissue, and that can make the airway crowded. Given the rate and prevalence of obesity, we're seeing more and more people with sleep apnea. Now, losing weight definitely helps manage sleep apnea, but also addressing sleep apnea can also help in losing weight. So those two are closely related. And at Bluepoint, one of the things we have is we have a combination of sleep medicine and weight loss center. So we're addressing both at the same time, so that can have a bigger impact on patients, because our goal is to diagnose sleep apnea, but also to make sure that it's adequately treated so you can get the benefit from the treatment. We've had many successful stories from our patients who are treated for sleep apnea. One particular patient, after a car accident, this particular patient fell asleep behind wheels, and he was referred to us for evaluation of sleep apnea. He turned out to have severe sleep apnea. So We diagnosed him, we treated him, and when he came back for follow-up, he was literally in tears, and he stated that he never felt that way for the last 20 to 30 years. He felt more energetic. He lost about 16 pounds in the first 2 weeks of treatment. He stopped taking naps during the day. His blood pressure was better controlled. He actually got off from 1 out of 3 of his medications. We've had many of stories like that from patients who are treated with sleep apnea.